Now we will be discussing the hip bone. This is the hip bone. It is a composite of three bones: the ilium above, pubis in front, and ischium behind. So this is ilium, pubis, and ischium. These three bones, they meet at this cup-shaped depression on the lateral side, which is called the acetabulum. This is the acetabulum. The ilium forms the upper 2/5 of the acetabulum. The ischium forms the postero-inferior 2/5 of the acetabulum, and the pubis forms the antero-inferior 2/5 of the antero-inferior 1/5 of the acetabulum. Talking about ilium at first, this ilium, which is forming the upper end of the hip bone, it has an upper end and a lower end. The lower end is at the acetabulum, and this is the upper end of the ilium. Then it has an anterior border, a medial border, and a posterior border. The surfaces are in between the anterior border and the medial border. This surface is the iliac fossa. In between the medial border and the posterior border, this surface is called the sacropelvic surface. And in between the anterior and posterior border, this entire surface is called the gluteal surface. So ilium, it has an upper end, a lower end, anterior border, medial border, posterior border, iliac fossa, sacropelvic surface, and the gluteal surface. Talking about the upper end first, the upper end of the ilium is called the iliac crest. It is, if we look from the anterior to posterior side, this is the anterior side, this is the posterior side. Antero-posteriorly, the iliac crest is convex upwards. It is convex upwards. And if we look from the medial and lateral side, the iliac crest, the anterior 2/3 is concave inwards, and the posterior 1/3 is convex inwards. This iliac crest is divided into a ventral 2/3 part and a dorsal 1/3 part. This is called the ventral segment of the iliac crest. This is the ventral segment of the iliac crest, and this is the dorsal segment of the iliac crest. The ventral segment of the iliac crest has an outer lip, an inner lip, and the intermediate area. While the dorsal segment, it has an outer slope, an inner slope, and the intermediate ridge. The anterior end of the iliac crest, this anterior end of the iliac crest is called anterior superior iliac spine. The anterior border starts from the anterior superior iliac spine and it goes down to another spine, which is called the anterior inferior iliac spine. So anterior superior iliac spine and anterior inferior iliac spine. Posteriorly, the posterior end of this iliac crest is called the posterior superior iliac spine. Lower down, this is the posterior inferior iliac spine, which leads to this great notch, which is called the greater sciatic notch. Greater sciatic notch. The outer lip of the iliac crest, around 5 centimeters behind the anterior superior iliac spine, has this tubercle, and this tubercle is called the tubercle of the iliac crest. We've talked about the anterior border and the posterior border. Now coming on to the medial border of the ilium. This medial border of the ilium, it starts from the iliac crest and continues down towards this eminence, which is called iliopubic eminence, because it is present between the ilium and the pubis. So it is called iliopubic eminence. Now coming on to the surfaces of the ilium, the surface present between this anterior border and the medial border, this is called the iliac fossa. The surface is called the iliac fossa. The surface which is present between the medial border and the posterior border, this surface is the sacropelvic surface. It is further divided into 3 parts. This portion above is called iliac tuberosity. This is iliac tuberosity. Then this L-shaped surface which articulates with the sacrum to form the sacroiliac joint, this surface is called the auricular surface because it is shaped like the pinna of the ear. So it is called the auricular surface. And this smooth surface, antero-inferior to the auricular surface, this smooth surface is called the pelvic surface, pelvic part of the sacro-pelvic surface. So, three parts of the sacropelvic surface: iliac tuberosity, auricular surface, and the pelvic surface. Laterally, this is the gluteal surface. In between the anterior border and the posterior border, this surface is the gluteal surface. Now, the gluteal surface is marked by three gluteal lines: a posterior gluteal line, anterior gluteal line, and the inferior gluteal line. The posterior gluteal line starts about 5 centimeters in front of the posterior superior iliac spine. So, it starts somewhere here at the iliac crest and it goes downwards to end just in front of the posterior inferior iliac spine. This is the posterior gluteal line. The anterior gluteal line starts about 5 to 6 centimeters behind the anterior superior iliac spine. It goes backwards and then downwards to end at the middle of the upper border of greater sciatic notch. Then the inferior gluteal line, which starts just above and behind the anterior inferior iliac spine, this line goes backwards and downwards again to meet the greater sciatic notch at its apex. So these are the three gluteal lines: the inferior gluteal line, the anterior gluteal line, and the posterior gluteal line, thereby dividing the gluteal surface into 4 parts. So this was about the general features of the ilium. Now coming on to the general features of the pubis bone. This is the pubis. This is the pubis, which forms the antero-inferior 1/5 of the acetabulum. Antero-inferior 1/5 of the acetabulum. This pubis has a body and a ramus. This is the body of the pubis and this is the ramus of the pubis. This is the ramus. The body of the pubis has a posterior surface. This is the medial or the symphysial surface. And this surface is the anterior surface. So it has a posterior surface, a medial surface, and an anterior surface. Superiorly, it has a pubic crest which ends in a tubercle, which is called the pubic tubercle. So pubic crest and pubic tubercle. This is the superior border of the body of the pubis. This is the pubic crest. Superior border of the body of pubis is called the pubic crest, and it ends laterally into a tubercle that is called the pubic tubercle. Laterally from the body of the pubis, this ramus is called the superior ramus of the pubis. This is the superior ramus of the pubis. And inferiorly, this ramus that is going down is called the inferior ramus of the pubis. So superior ramus and the inferior ramus. The superior ramus of the pubis, it has 3 borders. This is the superior border, which is starting from the pubic tubercle, from just behind the pubic tubercle, and it is going up till the iliopubic eminence. This is the superior border. The superior border is also called the pectineal line of pubis or the pectinate line of pubis. This is the inferior border of the superior ramus of pubis. Inferior border of the superior ramus of pubis. This border is forming the superior margin of the anterior superior margin of the obturator foramen. This large foramen which is separating the pubis from the ischium, this foramen is called the obturator foramen. So the inferior border of the superior ramus of pubis is forming the antero-inferior boundary of the obturator foramen. And now if I turn the bone like this border, which is starting from the pubic tubercle and going up till the acetabulum, this border is called the anterior border of the pubis. This is the anterior border of the pubis. This is the anterior border of the superior ramus of the pubis. So in between these borders, the surfaces that are demarcated for the superior ramus, this surface in between the superior border and the inferior border, this surface which is continuous with the posterior or the pelvic surface of the body of the pubis, this surface is called the pelvic surface. This is the pelvic surface of the superior ramus of pubis. Then this surface in between the superior border and the anterior border, this triangular surface whose apex is at the pubic tubercle and base is at the iliopubic eminence, this surface is called the pectineal surface of the superior ramus of pubis. And this surface between the inferior border and the anterior border, this surface is the obturator surface of superior ramus of pubis. Obturator surface of superior ramus of pubis. So these were the features of pubis. Now coming on to the ischium. This bone is ischium. It is forming the posterior-inferior part of the hip bone. This is ischium. It is forming the posterior-inferior part of the hip bone, and it forms the posterior-inferior 2/5 of the acetabulum. Acetabulum is the cup-shaped depression where all these three bones are meeting together at this Y-shaped cartilage. And the upper 2/5 is formed by the ilium, the posterior-inferior 2/5 is formed by the ischium, and the anterior-inferior 1/5 is formed by pubis. So this portion of the bone is ischium. Now this ischium also has an upper end and a lower end. The upper end meets at the acetabulum and the lower end is formed by this ischial tuberosity. This tuberosity is called the ischial tuberosity. The lower end of the ischium is formed by this ischial tuberosity and the upper end is formed by the posterior-inferior 2/5 of the acetabulum. Then it has an anterior border. This anterior border is forming the posterior margin of obturator foramen. It has a posterior border which is continuous with the posterior border of ilium. This is the posterior border. And it has a lateral border which is nothing but the lateral border of this ischial tuberosity. So it has three borders: the anterior border, the posterior border, and the lateral border. This is the lateral border. Now the surfaces of the ischium in between the anterior border and this posterior border. This surface is called the pelvic surface of the ischium. This is the pelvic surface of the ischium. In between the posterior border and the lateral border, this surface is the dorsal surface of the ischium. This is the dorsal surface of the ischium. Then in between this anterior border and the lateral border, this surface just adjacent to the acetabulum, inferior to the acetabulum, this surface is the femoral surface of ischium. So I'll repeat, this is the pelvic surface, this is the dorsal surface, and this surface is the femoral surface. If we look at the posterior border of the ischium, this posterior border at the upper end is forming the lower half of greater sciatic notch. The posterior border at the upper end is forming the lower half of greater sciatic notch. Then this projection is called the ischial spine. This is the ischial spine. And below the ischial spine, this notch is called the lesser sciatic notch. So this is the greater sciatic notch and this is the lesser sciatic notch. Now coming on to the ischial tuberosity, this is the ischial tuberosity. This ischial tuberosity is divided into two parts by a transverse ridge. It is divided into an upper part and a lower part. The upper part is further divided by this oblique ridge into a superolateral portion and an inferomedial portion. Superolateral, inferomedial. And the lower part is further divided by a vertical ridge into an outer part and an inner part. Outer part and the inner part. From the ischial tuberosity, this ischial ramus, it juts out at an acute angle to meet with the inferior ramus of the pubis. This forms the conjoint ischiopubic ramus. This conjoint ischiopubic ramus has an upper border, a lower border, inner surface, and an outer surface. So after knowing all the general features of this bone, we can now determine the side of this bone. This is how we hold it in anatomical position. We keep the first web space and the thumb like this in the greater sciatic notch. And if your fingers and your palm, if they are covering the acetabulum laterally, if they are covering it, then the hand in which you are holding the bone, that determines the side of the bone. So this is the right side bone. And in order to hold it in anatomical position, you have to tilt it little towards the anterior side. So this is the anterior side. You have to tilt the bone a little towards the anterior side so that the pubic tubercle and the anterior superior iliac spine, they fall in the same coronal plane. So this is how you hold it in anatomical position. The symphysial surface of the body of the pubis will face medially. The pelvic surface of the body of the pubis will face backwards and upwards. And the anterior superior iliac spine and the pubic tubercle will fall in the same coronal plane. They will fall in the same coronal plane. Now coming on to the attachments on this bone, we'll first start with the iliac crest. The iliac crest, as we said, is divided into a ventral segment and a dorsal segment. The ventral segment has an outer lip, inner lip, and the intermediate area. The outer lip in its anterior 2/3 portion, just anterior to this tubercle of the iliac crest, it provides origin to the tensor fascia lata. This muscle, the tensor fascia lata. And throughout its extent, it provides attachment to the fascia lata or the deep fascia of thigh. Then this tubercle of the iliac crest, it provides attachment to the iliotibial tract, the thickening of the fascia lata, which is called the iliotibial tract. The intermediate area of the iliac crest provides insertion to the external oblique muscle of the abdomen. This is the only insertion that is found on this bone. All the other attachments are the origins of various muscles. This is the only insertion. Then the posterior 1/3 of the outer lip, it provides attachment to latissimus dorsi. So if we see the outer lip of the iliac crest, in the anterior 1/3 portion, just anterior to the tubercle of the iliac crest, it is providing origin to the tensor fascia lata, and in the anterior 2/3 portion, it is providing insertion to the external oblique muscle, and in the posterior 1/3, it is providing origin to the latissimus dorsi muscle. Similarly, the inner lip of the iliac crest, in its anterior 2/3, it is providing origin to the transversus abdominis muscle of the abdomen, and in the posterior 1/3, it is providing origin to the quadratus lumborum muscle. So it is similar on the inner lip and the outer lip. The anterior 2/3 of the outer lip, external oblique. The anterior 2/3 of the inner lip will be transversus abdominis. The posterior 1/3 of the outer lip is latissimus dorsi, and the posterior 1/3 of the inner lip is quadratus lumborum. The entire outer lip is providing attachment to the fascia lata. The anterior 2/3 of the inner lip is providing attachment to the fascia transversalis, deep to the transversus abdominis, fascia transversalis, and fascia iliaca. Fascia transversalis above and fascia iliaca below. So both of these are attached to the inner lip. The around the attachment of the quadratus lumborum muscle is the attachment of the thoracolumbar fascia. And the intermediate area of the iliac crest is providing origin to the internal oblique muscle of the abdomen. So external oblique, internal oblique, transversus abdominis. Then coming on to the dorsal segment, the outer slope of the dorsal segment, along with the area posterior to this posterior gluteal line on the gluteal surface, this entire area is providing origin to the fibers of gluteus maximus. Although the maximum number of fibers of the gluteus maximus are arising from the sacrotuberous ligament, but this portion also gives origin to the gluteus maximus muscle. And the inner slope is providing origin to the erector spinae. So outer slope, gluteus maximus, inner slope, erector spinae. Deep to the attachment of the erector spinae, this area provides attachment to the ventral sacroiliac ligament. See, this was the auricular surface of the sacropelvic part of the ilium. This auricular surface will articulate with the reciprocal auricular surface on the sacrum to form the sacroiliac joint. And dorsal to that sacroiliac joint, this portion will provide attachment to the dorsal sacroiliac ligament. And this area, the sacropelvic of the sacropelvic surface, this is the iliac tuberosity, will provide attachment to the interosseous sacroiliac ligament. So interosseous sacroiliac ligament and the dorsal sacroiliac ligament. Coming on to the gluteal surface, the portion behind the posterior gluteal line, as I told earlier, will provide attachment to the gluteus maximus. The area in between the posterior and the anterior gluteal line will provide attachment to gluteus medius. The area in between the inferior gluteal line and anterior gluteal line will provide attachment to gluteus minimus. And the portion inferior to the inferior gluteal line will provide attachment to the reflected head of rectus femoris muscle. Reflected head of rectus femoris. So these are the attachments on the gluteal surface. On the sacropelvic surface, the iliac tuberosity will provide attachment to the interosseous sacroiliac ligament. The auricular surface will be involved in the formation of the sacroiliac joint. And this pelvic surface, at the upper border of the greater sciatic notch, the pelvic surface will provide attachment to a few fibers of piriformis muscle. So this is the attachment of a few fibers of piriformis. The iliac fossa in its upper two-thirds will be providing origin to iliacus muscle. Iliacus muscle, which will be covered over by the iliac fascia. That fascia iliaca or the iliac fascia will be attached to the inner lip of the iliac crest. Then this anterior superior iliac spine and the anterior inferior iliac spine, both will be providing attachment to one muscle and one ligament. At the anterior superior iliac spine, the muscle is sartorius and the ligament is the lateral end of inguinal ligament. So inguinal ligament is stretching in between this pubic tubercle and anterior superior iliac spine. This is the attachment of inguinal ligament. So anterior superior iliac spine is providing attachment to the lateral end of the inguinal ligament and to a muscle sartorius. The anterior inferior iliac spine is providing attachment to the straight head of rectus femoris. So rectus femoris, it has two heads. The straight head is coming from the anterior inferior iliac spine and the reflected head is coming from this part, which was this part of the gluteal surface, which was just inferior to the inferior gluteal line. So reflected head of rectus femoris and the straight head of rectus femoris. So all these are the attachments on the ilium. Now coming on to the attachments on the pubis bone. This was the pubis bone. This was the body of the pubis, the superior ramus and the inferior ramus. The inferior ramus was joining with the ramus of the ischium to form the conjoint ischiopubic ramus. Looking at the pelvic surface of the body of the pubis, at the center of the pelvic surface, it provides origin to fibers of levator ani. And just medial to this, it will provide attachment to puboprostatic ligaments. This pubic surface of the pubis is related posteriorly with the urinary bladder, and beneath the urinary bladder there is prostate. So just medial to the attachment of levator ani, it will provide attachment to puboprostatic and pubovesical ligaments. The upper border of the obturator foramen, or the just close to the obturator foramen, this entire margin will be providing attachment to the obturator internus muscle. This is the obturator internus muscle, the origin of obturator internus muscle, which also extends onto the pelvic surface of ischium. This was the pelvic surface of ischium. So this entire attachment is for obturator internus muscle. Then coming on to the anterior surface of the pubis. This is the anterior surface of the body of the pubis. At the angle in between the pubic tubercle and pubic symphysis, at this angle is the origin of adductor longus muscle. Then the symphysial border and the inner border of the ischiopubic ramus, the inferior or the inner border of the ischiopubic ramus, it provides origin to the gracilis muscle. So this was adductor longus. Here this is gracilis. Just lateral to the gracilis, there is origin of adductor brevis. And just lateral to that, along the margins of the obturator foramen externally, this is the attachment of the origin of obturator externus muscle. So from medial to lateral side, there is gracilis, adductor brevis and obturator externus. This muscle at the angle between the pubic at the angle between the pectinate line and the symphysial surface. This angle is occupied by the attachment of adductor longus. The pubic crest, medially, this pubic crest is crossed by the medial head of the rectus abdominis, and laterally it is providing attachment to the lateral head of rectus abdominis. So medially, it is covered by the medial head. Laterally, it is providing origin to lateral head of rectus abdominis. And just anterior to that, there is origin of pyramidalis muscle, pyramidalis, if it is present. Pubic tubercle, as we've already done, it provides attachment to the medial end of the inguinal ligament and some fibers of the cremaster muscle, the superior loops of the cremaster muscle. Then this pectineal surface of the superior ramus, pectineal surface, the upper half of the pectineal surface is providing origin to pectineus muscle. The pectinate line of the pubis, that is the superior border of the superior ramus, this pectinate line, it is providing along the entire length, is providing attachment to the fascia covering the pectineus. At the medial end, it provides attachment to the conjoint tendon, and just anterior to the conjoint tendon is the attachment of the lacunar ligament, which is an extension of the inguinal ligament, the lacunar ligament. And the lateral to the attachment of the lacunar ligament, lateral to the attachment of the lacunar ligament, it provides attachment to the pectinate ligament or the pectineal part of the inguinal ligament. So the pectinate line along the whole length, it is giving attachment to the fascia covering the pectineus. At the medial end, it is providing attachment to conjoint tendon. Anterior to the conjoint tendon, on the medial half itself, it is providing attachment to lacunar ligament. And on the lateral half, it is providing attachment to pectinate ligament. The inferior border, it is marked by a groove that will provide passage for the obturator nerves and vessels to pass out of the pelvic cavity into the medial aspect of the thigh. So this is the portion where the obturator membrane is absent. The inner border of the obturator foramen gives attachment to the obturator membrane, and at the upper end here at the region of the obturator groove, this obturator membrane is deficient for the passage of obturator nerves and vessels. Now coming on to the attachments of ischium. This is ischium. This was the upper end of the ischium. This is the lower end of the ischium. This is the ischial spine. This is greater sciatic notch and the lesser sciatic notch. The ischial spine on the pelvic surface gives attachment to the posterior fibers of levator ani muscle. And the ischial, the greater sciatic notch just beneath the ischial spine, it will be giving passage to the tendon of obturator internus muscle. And this obturator internus muscle, which will be arising from the pelvic surface of the ischium and from the margins of the obturator foramen. This muscle, the tendon of this muscle, will exit the pelvic cavity through the lesser sciatic notch like this. The upper and the lower margins of the lesser sciatic notch will be providing origin to two gemuli, the superior gemellus and the inferior gemellus. Then this dorsal surface of the ischium, this is the dorsal surface of the ischium. It is related to the piriformis muscle. The piriformis muscle will be exiting the pelvic cavity like this. So it is occupied, this dorsal surface, it is occupied by the piriformis, and beneath the piriformis, we will find the sciatic nerve. This groove that is present beneath this elevated portion of the dorsal surface, this groove will be occupied by the tendon of obturator internus on its way to insertion on the femur. So this groove is occupied by obturator internus muscle. Then just inferior to this portion is the ischial tuberosity. The superolateral part of the ischial tuberosity is providing origin to semimembranosus. The inferomedial part is providing origin to the long head of biceps femoris and semitendinosus. And in the lower part, the lateral portion is providing attachment to adductor magnus. So all these four muscles, the semimembranosus, semitendinosus with long head of biceps femoris, and the ischial head of adductor magnus, all these four muscles are the hamstrings. So ischial tuberosity is giving origin to the hamstrings. Then there is a part of the adductor magnus which is also arising from the conjoint ischiopubic ramus. This portion, this is the adductor part of adductor magnus. So adductor magnus will be having two parts, the hamstring part and the adductor part. The medial part of the lower half of the ischial tuberosity does not provide attachment to any muscle. It is only covered by the fibrofatty tissue, and it is this portion on which we sit. Then this medial margin of the ischial tuberosity, along with the posterior margin, upper part of the posterior margin of the ilium, this will be providing attachment to sacrotuberous ligament. So somewhere here will be the sacrum. So the sacrotuberous ligament will be arising from here and the sacrum, and it will come down and attach to the medial margin of the ischial tuberosity, sacrotuberous ligament. And from the sacrum to the ischial spine will be the sacrospinous ligament. Because of the presence of these two ligaments, these notches will be converted into foramens. This will be the greater sciatic foramen, and this will be the lesser sciatic foramen. So see, it's, like this will be the attachment of the sacrotuberous ligament, and like this will be the attachment of sacrospinous ligament, thereby dividing the greater sciatic and the lesser sciatic notches into greater sciatic and lesser sciatic foramen. The ischial spine, this is the ischial spine. It is related posteriorly with the pin structures. Pin structures, that is pudendal nerve, internal pudendal vessels, and the nerve to obturator internus. Pin structures, pudendal nerve, internal pudendal vessels, and the nerve to obturator internus. Then this lateral margin of the ischial tuberosity, the upper end of the lateral margin of the ischial tuberosity, it provides origin to quadratus femoris muscle. Quadratus femoris. Now this cup-shaped depression present laterally, it is called the acetabulum. The margins of the acetabulum will be providing attachment to the glenoid. The margins of the acetabulum will be providing attachment to now this cup-shaped depression, this is called the acetabulum. The margins of the acetabulum will be providing attachment to the acetabular labrum. This acetabulum is deficient here, and this portion is called the acetabular notch. This is the acetabular notch, and this notch is bridged over by a transverse acetabular ligament. If we see inside the acetabulum, this portion is articular and the floor is non-articular. The articular portion is called the lunate surface. This articular portion is called the lunate surface. And this non-articular depression, the non-articular fossa, is called the acetabular fossa. So this completes the hip bone.